I hate the dark color under my tired looking eyes. What can I do? No matter how much sleep I get, my eyes look tired and black.
Thank you for your question. You submitted your question with two photos. And you state in your question that you are not happy with the dark color under your eyes, and that no matter how much you sleep, you're not happy with the under eye appearance. And you submitted the photos to help explain your situation. Well, I can certainly share with you my perception of what I see with the photos and how I advise our patients who have similar concerns in my practice. A little bit of background: I'm a board certified cosmetic surgeon and fellowship trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with the under eye area to help them not look tired. It has been a central, significant part of my practice the entire time I've been in practice. Often patients come in saying essentially the same thing in not so many words. They'll say, I'm just tired of looking tired. And we live at a time when there is a lot of variables that we can actually address and customize the treatment plan for our patients based on certain anatomic aspects of their situation. So essentially, the analysis should begin with anatomy. A lot of times people look at themselves and they diagnose what they call or refer to their condition as dark circles. And it's kind of a broad term, and so naturally the first thing that a lot of people do is go to the store and buy creams for dark circles, and essentially then figure out that they're not getting what they want because the creams does not do anything specifically for what they want. Essentially, it might moisturize the skin, it might help tint the skin. So when we look at the under eye area, basically we look at it in a systematic way. First, we want to look, is there something called lower eyelid fat prolapse? What that means is the fat pockets that are normally around the eyes have prolapsed, pushed forward, and they create a hill. What's fascinating is a lot of times people don't notice the hill, but rather the sunken appearance. So they think they have hollow eyes. And so right below that hill of fat is an area called the tear trough. And the tear trough is this area which looks very sunken and can also look dark. Now, part of the explanation for this has to do with variables that include skin quality, skin pigmentation, the vascularity or the blood vessels under the skin. So the strategy with addressing this issue have to do really with the relative projection and prominence of the under eye bags. And I'll explain further. For many years, the gold standard for anyone for having under eye bags was to do some kind of surgical procedure, because essentially the underlying issue is a hernia of fat. So routinely, for a situation like this, we would consider surgery. However, we also now have an option which many people are exercising, and naturally a lot of people are getting this done in situations where it really doesn't meet the criteria for optimal management. And that is a procedure such as the use of an injectable filler, usually typically in the hyaluronic acid family. And what we do is I place into that tear trough area the hyaluronic acid filler with minimal trauma, using blunt cannulas to help soften the transition between the tear trough and the puffiness. So what's the threshold as to when you do one procedure versus another? Well, as a surgeon, of course, I'm not limited by any procedure. I do all these procedures, and so I basically advise my patients as follows. If the under eye area puffiness is so prominent that if you're adding filler that it can actually make it look worse, then that's a time when you don't do that. If the puffiness is actually extending past the tear trough and the eyes are too puffy, then you're not going to even have a place to actually place the filler. And then there are the patients who are kind of in the in-between stage. And a lot of times what we'll do first is we'll say, okay, you understand that surgery is probably a critically strategic approach to helping your issue. And that's not even considering the other anatomic issues such as the cheek volume. But let's say focus on just that area. Then what we can do is we can try placement of a hyaluronic acid filler in the tear trough area, and then we follow our patients and see our patients 2 weeks later and see how they look. And generally speaking, in the right patient, it's a pretty good, you can get a pretty nice result. Now, there are patients who have come to us who have had this approach done elsewhere, and they end up with tremendous puffiness under their eyes from the hyaluronic acid filler or from just the volume of the filler. And we end up using hyaluronidase to actually dissolve the filler, and then actually see what's the true underlying anatomy. And then we discuss options with those patients. Sometimes the options include an alternative hyaluronic acid filler or to move forward with the surgical procedure. And one doesn't really negate the other. When someone has relative hollowness, you can also think of the eye and cheek volume relationship. And so sometimes it's really a combination of the two. You can reduce the puffiness, reevaluate, and then add volume in a tear trough to try to balance and improve the appearance. There's an area called the V deformity that can sometimes also benefit from volume, and as well as the projection of the cheek. So as you can imagine, there's a lot of different scenarios. To speak towards the surgical scenario, when there's puffiness like what you have, it is pretty common for me to do a procedure called a transconjunctival blepharoplasty. This is a procedure where I address those fat pockets from the inside of the eyelid. That way you avoid an external incision and you're able to more definitively address the puffiness. And when patients are afraid of surgery because they're afraid of typically general anesthesia and the potential complications of surgery, well, I explain to them that the procedures are done in my office operating facility as opposed to going to a hospital or surgery center, and it's done under local anesthesia with light sedation. So in many ways it has so many comparatively similarities to an injectable procedure, and it is in many ways, one can argue, invasive as an injectable, but of course it is a little more involved. But that being said, if that's the procedure that's optimal, then you want to do it in the safest and most predictable way. And that's what we have been able to show our patients for over 20 years, that for me is an optimal approach. So I think beyond that, when you talk about color, you also can address the area with things to help skin quality. But I think skin quality, whether it's improved with laser or with platelet-rich plasma, is a secondary issue compared to what is the primary, which is the dual balance of a hollow or the valley next to the mountain. So meet with qualified, experienced cosmetic surgeons who do a lot of lower eyelid surgery and are very comfortable with injectables. This way you avoid the bias. What I find is the bias is that there's so many more doctors who offer injectables because there are so fewer doctors who are actually surgeons, just proportionately, that a lot of patients who would otherwise benefit from surgery are ending up getting fillers because the doctor simply just doesn't want to refer them for surgery, and that's just the harsh reality of the business of medicine. So meet with a surgeon in this way, who does all this, and this way there's no bias one way or the other, but rather more comprehensive solutions to be provided, and see what's right for you. A three-dimensional evaluation is what's necessary in order to get a more definitive answer, and of course the the experience of the doctor also determines what they would recommend for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.